Is there any non-surgical way to reduce my breast size? Now, this is the most common question that I face during a breast reduction surgery consultation. I'll try to answer this and give you a few more points regarding breast reduction surgery. Well, in breast reduction, if the breasts are naturally heavy because of hormone issues or genetic issues, then just weight loss is not going to help completely, because breasts have gland, they have fat, they also have extra skin. So with weight loss, the fat component goes down, but to remove the extra skin and the extra gland, we require a surgical procedure. So that's why just weight loss, no, it's not a good option. Well, liposuction is a compromise procedure in which we can suck out the extra fat without having to go for weight loss. That will reduce the volume of the breast, but to a certain extent. For a proper decreased size of the breast, you require a surgery. The next question is, who should get a breast reduction surgery done? Well, if you're having issues because of increased breast size, that could be physical, like neck pain, back pain, posture issues. If the bra straps are digging into the shoulders and causing a lot of injury and rashes over there, rashes in the undersurface of the breasts. If your posture is constantly bent and you're having trouble in doing routine activities or exercising, if you're having embarrassment because of the increased breast size. In short, if your breasts are causing any hindrance or hampering you from achieving what you want, you are a good candidate for breast reduction. Scars are something a lot of people are worried about following breast reduction. Is there a possibility of a scar? Yes, because in breast reduction, we're removing tissue that will involve a cut and that will leave a scar. Depending upon how much tissue we remove, the scar could be either circular around the nipple itself, or circular and a vertical limb, or inverted T-shaped scar. So these scars, however, heal very well and they are very fine. After the healing is complete, we can go for either a laser treatment or for scar reducing creams, which ensure that the scars are pretty mature, very faint, and not very conspicuous. Nipple sensation and breastfeeding is a very pressing concern in young patients who undergo breast reduction. After a breast reduction surgery, well, the nipple sensation may be altered slightly for a few days because of the incisions that we take, but that recovers and comes back to normal in a few weeks to few months. So you end up with normal nipple sensation. And considering breastfeeding, during breastfeeding surgery, what we do is we preserve the nipple and the glands and the ducts that are underneath the nipple. So breastfeeding after reduction surgery should not be an issue for anyone. And the final question, will my breasts go back to what their original size was post reduction surgery? Well, no. If we take out an adequate amount of gland and the extra skin, well, then the breasts are not going to go back to what they originally were, even if there is pregnancy or breastfeeding after the procedure. With weight gain, yes, the fat component will increase, the breast might become slightly heavier, but they are not going to go back to their original size. If you have any other questions you want to get answered or you want more information about the procedure, either comment below or you can DM us and I'll be happy to reach out to you. Thank you.